Greetings everyone, my name is Mohammed Tanzilul Haq and today we shall be discussing in detail about case reports. Let us begin by familiarizing ourselves with the definition first. So as you see in the slide, case reports are defined as the scientific studies of a single clinical observation. It is a detailed report of signs and symptoms, diagnosis and treatment, and the follow-up of an individual patient or sometimes patients. So basically, it is a new or a rare finding that will help the medical community understand more about a particular disease. So what could be these unique findings that I have mentioned? To summarize, there are 4 types as you see in the slide. Number 1, unexpected connection between a disease or a symptom. Let's say you come across a patient with diabetes mellitus. We all know what the disease is, right? This patient develops a new symptom not proven by previous literature, or it is a known finding but it is rare. So it is your case and you can present it as a case report, and this would add to the literature of that symptom. Number 2, an unexpected turn of events in the course of treating a patient. For example, a comatose patient infected with COVID-19 virus is being treated with multiple drug therapies and they suddenly become better and show some promising signs. Now, this is an unexpected turn of events and you definitely want it to be reported. Number 3, a unique aspect of a disease. So let us assume the first patient of diabetes mellitus we have talked about earlier developed something that is known as myonecrosis. Now, myonecrosis with diabetes mellitus is not a very known finding. So this is unique to this disease. So this should be published as a case report as well. And lastly, a unique approach to treatment. Let us assume another patient, which is a known case of hyperthyroidism, which is just our thyroid being more active. This patient suddenly goes asymptomatic after a flare of disease, and you find that a certain combination of drugs during their treatment halted their symptoms. So this different approach to treatment that you see being used for that particular patient should be presented in literature for helping other physicians, and this is your case report. Now we know the different ways of how we can write and what are the different means of writing a case report. Let me explain you how we can actually frame it. So a case report should be short and focused with a limited number of figures and references, as you see in this slide. So the word count should be about 1,000 to 1,500 words with 10 references to 4 to 8 authors contributing to that particular case. At this point, I would like to introduce you to another term that is similar to case report, the case series. Some of you might have heard about it before. Case series are similar to case reports except for the fact that instead of being for a single participant or a single patient or a single subject, a group of a patient is involved for a case series. So what do I mean by that? You have to monitor a few things while you are doing that. You monitor the efficacy of new interventions, you determine the efficacy of interventions on an unusual diagnosis, and then you describe the unusual responses to intervention on these particular different patients. They're not related, they're not grouped, they might be in different parts of the world, different parts of the cities, but they have the similar presentation. A case series can be conducted retrospectively, which means that you can go back and evaluate the case, or prospectively as well. So by saying that, you might confuse case series with the term cohort study. So a cohort study, just to remind, enables the calculation of an absolute risk of or rate of the outcome, as you might have guessed, and such a calculation is not possible for a case series because they are not related and they're not in the same part, and maybe different case reports may be compiled. To help you understand case series, I'll give you a very famous example from the US. In the 1980s, 4 previously healthy young men were infected with pneumocystis carinii pneumonia, which is an unusual opportunistic infection that had only been seen previously in the immunocompromised patients or somebody with hereditary disorders that led to an immunocompromised state. Medical professionals were worried why these 4 people were having symptoms of pneumocystis carinii pneumonia. What happened was that they had low T cell counts and their decreased immune responses, which led to further dig up on the patients, and this was found that the 4 men were actively homosexual. And in the case series was published in the New England Journal of Medicine, the authors speculated that the immune dysfunction was due to a sexually transmitted infectious agent. So there was no control group in this because this is a case series. Individual patients were seen and described, and this was an extraordinarily important case series and suggested that this new syndrome was actually due to sexually active homosexuals. So we come to the next part of back to case reports now, the journal format. So your journal format for case reports as entitled is based on four factors. You have the title, which is supposed to be short and precise. And then we come to the abstract. Some journals do not require an abstract, some journals do, and when they do, it's usually an unstructured one where you do not have the headings for the abstract. And then we come to the introduction of the case report. So the introduction is an important part. It shows the reader why the particular case report was conducted, what are the new and useful diagnoses and the management plans that are going to be discussed in the case report. Now coming to the discussion part for the case report. The most important part of the discussion is that you need to divide them into separate paragraphs, it's separate findings, management plans. It makes it easier for the reader to comprehend that. It signifies and convinces the journal to publish your study, and it can be divided into multiple paragraphs like I have mentioned as stated in the slide as well. So what can be different in the discussion is that the authors can explain their own opinions, serve as a commentary talking about the case, and report cases in context with other similar cases as well. So references can be put in the discussion section. You have to skip any unnecessary literature, any unnecessary references as well to not make your case report very lengthy. Your message should be clear, and you must also mention any shortfalls or any limitations in the discussion section. For example, you're writing about a treatment plan that helped suddenly alleviate the symptoms of hyperthyroidism that we discussed earlier. You need to explain the relevance of any medications and interventions that you had used during the study. References should be quoted to link the data to similar past studies. A conclusion is always not necessary, but you can use a conclusion to summarize the important aspects of your research. Now we know how to frame it, how to select a topic. Now, how do you start and how do you dig for the topic? Coming to that part. This slide gives you a comprehensive description regarding these things. You might want to take notes from it. You need a doctor on board to walk you through the different medical aspects of the disease at this stage of your medical career. We all know clinical practice outweighs any book, right? So you need a doctor on board. So you do extensive literature search to make sure your project is unique, gather all the similar and relevant articles, and you give them a read and extract information from it. You can use a PDF and highlight it, or you can print it up and underline it, whatever suits you. So this is how you do that. So coming to the second part of this slide, which is obtaining the consent from the patient. A very significant matter is this, that you have to obtain the consent from the patient before you start beginning a case report. Obtaining an informed and signed consent is not only ethical, but also it is a requirement of some journals. So you'll have to present it while you have to submit it for submission. So in case the patient is a minor, the parental consent is required, and if it's an adult but they are not able to consent because they are in a coma or mentally not stable, a closest family member can give consent on their behalf. So now we come to the slide about how do we select a topic and how do you go about it in a definitive manner. So the resources and techniques to know about unique presentation, the answer to the question is, again, make contacts. So on this slide, you see 3 bullets for the same opinion. You need to socialize in your profession, interact with physicians who work on these cases, and ask for their guidance. And lastly, do your own homework as well. By own homework, I mean you do your literature search and you jot down the points like discussed earlier. So how to look for journals for case reports and publications. So not all journals accept case reports is the first point of this particular slide. So before beginning to read and before beginning to write, you have to know the submission guidelines for the particular journal. So by reading the submission guidelines, you will actually be sure how to present it for that particular publication article. So you read previously published case reports and understand the methods that are used there in that particular journal, and you can dedicate an allotted time, for example 2 hours every Sunday for this purpose, for the literature search, or maybe while you're coming to your university or anywhere. Maybe dedicated time is always very necessary while you are doing the literature search. You can't just do it on and off. You have to dedicate some time for that. So this is a screenshot from the free online search website, which is known as the Schemago. You can see the screenshot on this slide. You can also see the link there. You can copy it down and search it. So this basically Schemago is a detailed website where you can locate the particular journal that you require for the case report. You can see the relevant description here. I'll show you with my cursor. The titles on the left, and then you see the type of the journal, the impact factor, and so on and so forth, the publication country, if that's relevant, and the references that have been quoted. So you see the relevance of that journal, and the more relevant the journal is for you, you have to choose that to make your study look more credible. So second last slide is an example of a published case report. This is a rare case of gangrenous foot in juvenile systemic lupus erythematosus. It is a report published by one of our co-founders, Dr. Farah Yasmin. This topic is clear and concise, and as you can see, it has an unstructured abstract and keywords, and then an introduction can be seen. This brings us to the end of our presentation. If you have any questions, feel free to search on our website or our social media handles, or you can email us at any time. Thank you for listening patiently, and good luck for your project. See you in another video.